Good afternoon, viewers. Me, Sharmi Patel. Today we are going to talk about cervical cancer screening and its awareness. Cervical cancer develops in a woman's cervix, the entrance of the uterus from the vagina, and it is the second most commonest cancer after the breast cancer in the woman. So, since January month is called as a cervical month, cervical cancer awareness month, and it's a great time to talk about cervical cancer screening. I welcome Dr. Krishnaveni Naimi, Senior Consultant Obstetricians and Gynecologist at KPHP Ankura Women and Children Hospital. Madam comes with 20 years of rich experience in the obstetric and gynecology segment. She has worked for past 12 years in UK, and she has obtained a certificate in the training in obstetricians and gynecology from RCOG London, as well as accredited with British Colposcopy Society. So here, welcome you, ma'am. Please give us a insight about what is cervical cancer and how to deal, prevent a cervical cancer.
Okay, thank you, Sharmi, and hello to all the viewers. So cervical cancer, as you said, Sharmi, it is the second most common cancer for the woman after the breast cancer. This is nothing but the cancer of the neck of the womb. That is where the baby comes from. That is the entrance of the womb. Okay, so the cervical cancer incidence is very, very high in India. It's like if you look at it, nearly like 78,000 people die every year in India with the cervical cancer. If you look at the disease burden, like we contribute to 1/3 of the global deaths of cervical cancer every year. And if you see, like every 24 hours, 200 women die with cervical cancer in India. And if you look at like every 1 hour, 8 women die. And every 7 minutes, 1 woman dies with a cervical cancer. So it's very, very common in India. But obviously, like we don't have the good screening program as the developed countries like UK and US. Even those countries in the past, like in 1900s, they had very high incidence of cervical cancer. But because of the introduction of the good screening program, now the cervical cancer incidence has decreased drastically there. So the aim of the talk today is we have to have a good screening program to diagnose this condition early and treat the woman early, because the cervical cancer is one of the cancer where the precancerous stage runs for nearly 10 to 15 years. If we can pick up this condition in the precancerous stage, we can treat with a very simple surgery and women can have neo-normal life, and this will reduce the mortality from the cervical cancer.
Okay. So, ma'am, you mentioned about cervical cancer, but as a woman, how do we come to know that this is a cervical cancer symptom? So, could you please elaborate what are the symptoms of cervical cancer?
Okay, so if the woman has the cervical cancer, sometimes they may not be symptomatic at all. Sometimes if they come for other gynecological examination, we may note that there is some abnormality in cervix and then we may diagnose it. Or sometimes they may have the abnormal uterine bleeding. That could be in the form of like the bleeding in between the periods or the bleeding after the intercourse, or sometimes they can bleed after the menopause, that is after stopping their periods. Or sometimes they can present with like excessive vaginal discharge and obviously like abnormal vaginal discharge. Or sometimes they can present with the pain in the lower part of the tummy, or they can present with the pain in the leg, and that is because of the swelling of the lymph nodes. And sometimes they can present with bleeding from the anal canal, that is from the back passage. That would happen in the advanced cases when the cancer has spread to the back passage, that is the rectum and the anal canal. So, like there are certain risk factors which predisposes this woman for cervical cancer. So, like now, the women are becoming sexually active very early because we have got that living in culture, even in India, like Western countries, and also we have in certain rural parts of the country still people have the marriages done at very young age. So, if they have the like early exposure to the sexual activity, then they are more prone for the cervical cancer. And also, if the women have multiple sexual partners, that again predisposes them for the cervical cancer. And also, if the women are smoking, that again predisposes them for the cervical cancer. And also, if the woman doesn't come for the screening because they never get tested and they do not know about it, and then their chances of having cervical cancer is very high. So, how we can reduce this risk is like the sexual activity has to be started a little bit later, like after 20s, and also the reducing the number of partners, that is like multiple sexual partners have to be avoided, and they have to use the condoms, that is to prevent the cervical cancer, that is like it is caused by a virus called HPV, and that could prevent those things. And also avoiding the smoking will reduce the cervical cancer.
Okay. So these are the symptoms and risk factors involved with the cervical cancer. But what causes cervical cancer? I mean, you have given a kind of brief, but if you could elaborate on causes of cervical cancer, that will help us understand.
Okay. So the cervical is caused by a called human papilloma virus. Like there are 150 types of this human papilloma virus, but among them, like the HPV 16 and 18 are very oncogenic. That means that the risk of causing cancer with these 16 and 18 viruses is very high. So what happens, like nearly 80% of the men and women who are sexually active, we have this virus in our body, but like with a good immunity, over the period of 2 to 3 years time, we get rid of this virus. But some of us are not able to get rid of this virus, and that stays in their body, and that in 2%, 1 to 2% of the patients, it causes cervical cancer. As we discussed, like it has a very prolonged precancerous period. So it takes nearly 12 to 15 years to develop into actual cancer. So if you can get the screening done during this period, then we can prevent this cervical cancer.
Okay. So these are about the causes of cervical cancer. Now, who are at the risk of getting cervical cancer, and how can you reduce the risk? What are the preventive measures one should take it up to?
Okay, so as we discussed already, Sharmi, we said about multiple sexual partners, early sexual activity, and obviously like smoking, those are the risk factors. So if you can avoid this, and also the HPV I discussed about using the condoms, that will help to reduce the cervical cancer.
Okay.
And having the screening at regular intervals would help to reduce the cervical cancer.
Yeah. So when it comes to screening, like, every woman have that in mind, that what does the cervical cancer screening involves? Why do the women need to keep getting retested for cervical cancer screening? How does it help, and why that periodical screening is required? Could you please elaborate on that, ma'am?
Okay, it's really a very good question, Sharmi. So all the women who are between the ages of 25 to 65 years needs this cervical cancer screening. So we call this test as the pap smear test. So we used to do this test before, but now the terminology is slightly changed. Now we call it as cervical sample and the liquid-based cytology. So the women who are between 25 to 50 years, they have to have this test done once in every 3 years.
Okay.
The women who are between 50 to 65 should have this test done every 5 years. So when the woman comes to the clinic, we offer this test to the woman to have the test done. But some of the women have the financial constraints. Some of them have they feel shy to have the test done. They do not want to show their private parts. And some of them are not aware of it. They're ignorant. And some of them get scared because they are going to be diagnosed with a cancer. And so they do not want to have the test done.
Okay.
But in developed countries like UK and US, it's a compulsory. They give the invitation for the woman once in every 3 years, and everybody goes there to have the test done. Hence, they are able to reduce this instance of cervical cancer drastically. So we have to bring that awareness, and we have to make the woman to think that if she is fine, then whole her family would be fine.
Absolutely.
So we have to educate the woman basically to have this screening test done.
Yeah.
So it's a very, very simple test. There is no need to get scared at all. So when the woman comes to the clinic, what we do is it's like other gynecological examination. We gently introduce the speculum into her vagina, and then that will help to actually show this cervix, the entrance of the womb. And then we take a tiny brush. It's like, I would say, like it looks small, like a broomstick kind of thing. And then we try to scrape the cells from the outside of the cervix and inside of the cervix. And it won't hurt at all. And they just have a bit of a stretchy feeling when we are doing that test. And then we take that sample and we send it to the lab. And then the pathologist or the cytologist looks under the microscope, and then they report the smear. And most of the time, it comes back as normal. And only, as I said, in few women, it comes back as abnormal.
So exactly. Yeah. Sorry. So ma'am, see, you gave me a very good, comfort that it's a very tiny test where, a woman has to undergo and that tiny cell is being scraped. A lot of women are scared of, the result of pap smear. So where we are talking about normal, we all are happy. But what happens when the pap smear test comes up normal? So what is the next level of course?
Okay, so if the test comes back as abnormal, it could be either of the three things. One of them is it could be inflammation could be there. Then sometimes inflammation could be caused by like little bit of infections, or when we are scraping the smear itself, there could be little bit of changes. That most of the time we don't need to do anything further. And sometimes if the inflammation is there, if we are seeing a bacteria, then we treat them with the antibiotics. If we see the fungal infections, then we treat them with the antifungal agents. And if the other possibility could be like a precancerous cells. The precancerous means it is not cancer yet. If you leave it untreated, maybe next 10, 15 years, it could develop into cancer. So that is the stage where we are aiming to diagnose the condition and treat it early, so to prevent the cancer. So the precancerous stage has like 3 stages in cervical cancer, like CIN1, CIN2, and CIN3. So it is graded depending upon the abnormality. CIN1 is the very minor abnormality. CIN3 is the major abnormality, but still it is not cancer. Okay. So if it is a minor abnormality, sometimes we just observe them and repeat the smear after 1 year. Or sometimes we go for a further test called HPV testing, because as you remember, I said all this is caused by HPV virus. So if there is a HPV, then obviously this can turn further into cancer. If the HPV has washed off, she has developed the immunity, then it won't develop into cancer. Okay. If it is a major abnormality like CIN2 or 3, then they require a very, very small surgery. Like we use a tiny loop, and then we try to shave that abnormal area. And then again, they can have normal pregnancies, they can have normal life, there won't be any problems at all. Okay. And the last possibility is the cancer. Even if there is a cancer, cervical cancer, now we have very advanced treatments. And again, it depends upon what is the staging of the cancer, depending upon, like we do further investigations like MRI scan to know the spread of the cancer. And depending upon that, they will be either offered the surgery or like a radiotherapy, like a treatment with the electric thing, or it could be the chemotherapy, that will be the medicines they give to treat the cancer. And the survival rate is very good. And obviously, the key is diagnose it early and treat it early.
Right. So, ma'am, we keep hearing about, screening and the treatment, and if it comes abnormal. So, lot of women, and when we go to gynecologists, they talk about colposcopy. So, what exactly is the colposcopy? Can you just educate us on that? How does it help in preventing or awareness of cervical cancer?
Okay, so it's like how we do the smear test. It is like a second grade of the screening test, the colposcopy. Now, the smear has said that there is an abnormality. Now, what is the next step? Is the abnormality really there, or is it just like a false positive? We need to look at that. And if it is there, what is the extent of it? So, colposcopy is nothing but it's like a magnified lens, like a binocular magnified lens, where we see the cervix like magnified up to 4 to 10 times. And then we use like a vinegar kind of a solution to paint the cervix, and also like an iodine kind of a solution to paint the cervix to see where this abnormality is. And depending upon that, we offer the treatment depending upon the abnormality. So again, the colposcopy, they don't require any anesthesia, and it is just visualizing the cervix with a like a magnified microscope.
So it's just done as a routine examination in OPD that can be done.
Yes, it is again the OP procedure. Yes, yeah. Only if you need to give a treatment like a loop treatment, even in that case, we do the local anesthesia around that part and on that area and take out that abnormal area.
Yes. Thank you, ma'am. So next question is this, do this abnormal test or abnormal smears runs in the family? Is it a genetic or hereditary, how they say that? Does it runs like that, cervical cancer?
No, not really. Like if you say her mother had the abnormal smears, it doesn't mean that her daughter also should need to have the abnormal smears. But sometimes there could be other coincidental things. Like we see sometimes, like if mother had difficulties in raising up the child, if she had very early marriage or multiple sexual partners, if she is a smoker, we don't see much often in our society, but in the Western society, this is very common. And the way she brings up her child also has a little bit of impact. So the daughter also could be in a similar way, and that can correlate. But genetically, no, it is not inherited. Okay, so it is mainly our lifestyle factor that can affect rather than the genetics here.
Yeah. So how do we prevent the cervical cancer? What are the preventive measures one woman should take it in her day-to-day life?
Okay. So first of all, like we need to bring this awareness, and they need to come for the screening program. And obviously, developing countries like India, we do have the financial constraints, and I think the government is taking a role and making this program to spread even to the rural parts of the world, like India. And obviously, women should come forward to have the screening test done. That is the important thing, one of the important thing to prevent this cervical cancer. And other thing is, sometimes you asked previously, like, why should we have this repeated testing? I had once in my life, is it not over? It is same like any other blood test or any other scan. Obviously, you have screened now, there is no abnormality, but your lifestyle factors can change. Like you may meet with the other partner, or you may get infected with the HPV at later part of your life. And that's why we need to keep doing this rescreening once in every 3 years.
Yes.
And the other important thing is the vaccination, HPV vaccination. Obviously, this HPV vaccination program has been started in UK in 2008. And from that time, they have noted that even the genital warts that is caused by this HPV virus have drastically decreased. And so these are the two key steps, that is the screening and having a vaccination would prevent the cervical cancer.
Great. So, ma'am, that was my next question. Actually, wanted to understand, and if you could educate us that how important is HPV vaccine in our life, and when should we take this vaccine?
Okay, so HPV vaccine is actually designed for the young girls between 12 to 15 years, and
Okay.
obviously before they have the sexual activity started. Okay, so when they're not exposed to this HPV virus, you are giving this vaccine, then they will develop the immunity against this HPV that will prevent them having this warts, genital warts, and also the cervical cancer. And obviously, the program has been extrapolated to even to include up to the ages of 18, 25. And obviously, it depends upon when they are starting their sexual activity. So if they're not sexually active, they can take it up to 25 also. But by the age of 25, most of the women are sexually active. And if they are sexually active, they are naturally getting that virus infected into their body. So they are already developing that immunity. So for them, the important thing is to have the screening every 3 years. Even the girls who get vaccinated with the HPV virus, they have to have the screening program because they have to have the screening test, the pap smear, once in every 3 years, because we still do not have the studies that it is completely going to eradicate. Because now the vaccines that are available are like, we have 3 of them available. Okay, that is Gardasil, which helps to prevent 4 kinds of the viruses. Okay, and Cervarix that acts for only 2 viruses, 16 and 18. And there is another nanovalent vaccine which has been recently introduced that works for 9 viruses. But there are, as I said, there are 150 types of this HPV, like same like corona. There are various variants are there. So it is not going to 100% prevent it. That's why the most oncogenic ones they are going to prevent. But still there could be less ones. That's why they should have the screening program. And obviously the most suitable age is all the young girls who are in 8th class, that is the age 12 to 13. And it is given in 3 doses, the vaccination. Usually if they're less than 15, they give only 2 doses. And if they're more than 15, now the recommendation is to give it in 3 doses, like the day they come, and then on the first month or second month, depending upon the type of vaccination they are choosing. And the last dose it at 6 months they have it.
Right. Thank you so much, ma'am, for giving us a lot of understanding and screening awareness for cervical cancer. So if I had to ask in a one way that what is the brief about cervical cancer and what is the take-home message every woman should take it, if you could just brief us on the complete cervical cancer.
Yeah. So my plea and urge to all the women is, please go and consult your gynecologist if you fall into the age group between 25 to 65 and have the cervical cancer screening test, that is the pap smear, and you should have it once in every 3 years. And obviously we all think like, why should I spend this 1,000 rupees or 1,200 for this test? Always think at the back of your mind, like you are doing so much hard work for you and for your family, and you have to look after yourself to keep your family fit and healthy, actually. Isn't it? The woman is the backbone. And we buy a lot of saris, dresses, jewelry, we spend on all those things. Why don't you spend 1,000 rupees for yourself? Please go and have the pap smear if you've not had so far, and keep having it until you reach 65. Okay. So hopefully.
Thank you so much.
Yeah.
Thank you so much, ma'am, for giving us the complete understanding about cervical cancer screening. So my fellow women, I also request you everyone, we are running throughout the month 50% of discount on cancer screening awareness program and a free gynec consultation. Please do come and consult us at Ankura Women's and Child Hospital, any of the branches, and we have senior doctors available who will guide you and help you make understand that how to prevent cervical cancer. So thank you so much, ma'am. Thank you very much, and thank you, viewers, for joining us today. Thank you.
Thank you, Sharmi. Thank you, everyone.